Hello. Imagine this, living day to day, shaking uncontrollably, and not being able to control parts of your body. This is what a person with Parkinson's disease goes through every day. To give you a better insight in this disease, I will be discussing 3 main points. The first one is what the disease is and its symptoms. The second one is the treatment options. And the third one is the different stages of the disease. Parkinson's disease is a progressive disease of the nervous system, which generally affects middle-aged to elderly people. The symptoms of Parkinson's includes more than just uncontrollable shaking. It also includes tremors in your legs, shuffling your feet when you're walking, a stooped or slumped posture, as well as many other things. To help get a better understanding of the symptoms, I will pull up a visual from the American Parkinson's Disease Association website and discuss the different points. These are the different symptoms in a graph. There is also a masked face, a forward tilt of the trunk, which is just slumping over, reduced arm swing when walking, hand tremors, which is shaking of the hand, a slightly flexed hip and knee, which is bending your hip and knee, shuffling the feet when you're walking, which is just not picking up your feet when you walk, tremors in the legs, which is just shaking of the legs, a flexed elbow and wrist, a back slump and slumped posture, which is slumping in the back. After discussing what Parkinson's disease is and the symptoms that come along with it, you may be wondering what some of the treatments are for this disease. Parkinson's disease is one that doesn't have a direct treatment. A Parkinson's patient may choose to take medications to increase their dopamine levels, which will then help control the symptoms, and it'll give them a little bit more comfort. I will now play a short video of Dr. Joseph Jankovic from the Parkinson's Foundation website.
Well, with the possible exception of infectious diseases, there's really very few diseases that can be cured, and Parkinson's disease is only one of the diseases where a cure has not yet been found. That doesn't necessarily mean that Parkinson's disease is not a treatable disease. It clearly is a treatable disorder, and we can treat it in different ways. We can treat the symptoms of Parkinson's disease, and there are many medications that have been proven to be very effective and safe in the treatment of symptoms of Parkinson's disease, particularly the dopaminergic drugs that stimulate the dopaminergic system. Levodopa is the best example. It replaces dopamine, which is the neurotransmitter that is missing in the brains of patients with Parkinson's disease. Then there are drugs, so-called dopamine agonists, that stimulate the dopamine receptors. They can also improve the symptoms of Parkinson's disease. So these are classic symptomatic therapies that we have for Parkinson's disease. Then there are therapies that we hope will favorably modify the progression of the disease, the so-called disease-modifying or neuroprotective drugs. I wish I could tell you that we have neuroprotective drugs, but there are certain medications that we have found delay the progression of the disease, and
By now, you know what the disease is and the symptoms that go hand in hand with it, as well as knowing a few options that the patients have to choose their treatment. Patients choose their treatment options based on which stage of the disease that they are in. There are currently 5 stages of Parkinson's disease, 1 being the stage with the most manageable symptoms, and 5 being the worst stage with the worst symptoms that are the worst to manage. I will now pull up a chart from the Parkinson's Chronicle websites that will go more in depth with the 5 different stages. So the first stage has mild and unsevere symptoms, which are tremors on one side and postural changes that are observed. The second stage is moderate symptoms with facial modifications, which is tremors on both sides and the body is observed so you can see them. Stage 3 is the progression of the disease is occurred. It's an imbalance in the body and improper reflexes are observed. Stage 4 is drastic changes. Personal assistance is required even with simple tasks. And stage 5 is the advanced stage with aggressive symptoms, hallucinations, and spasms occur in this stage. Now you are all aware of exactly what Parkinson's disease is, the symptoms, the different stages. I hope that this speech has served its purpose in providing you with some more information on Parkinson's disease.